Hey, good morning everybody. Dr. Tam here. So today I want to talk to you about the prevalence of diabetes here in the US, okay? Almost 20 million and climbing at a very significant rate of people in the US alone have severe diabetes, okay? When I mean severe diabetes, which means that this is full-blown diabetes, I want you guys to know that diabetes is not something to take lightly. Most people that I talk to who are pre-diabetic tells me, well, Dr. Tam, I don't have diabetes yet. I'll make those changes when I get diabetic. Well, but you got to understand this. By the time you become diabetic, pancreas and your liver has already failed so much where the sugar levels in your blood continues to rise. One of the articles that I just read this morning, was an article done by UC Berkeley in 2015, is they looked at the prevalence of people with diabetes, and certain studies, including this one, shows that so many people with diabetes ends up developing something called peripheral neuropathy. Now, peripheral neuropathy is where you start to have blood vessels. See, because too much sugar in the blood kills off and deteriorates your blood vessels. Where does it do that first? It deteriorates your blood vessels furthest away from the heart, which is your toes, your fingers, your foot, your ankle, your calves, your elbows, and your wrists, okay? That's where it starts to develop. Most of the time, about 80% of the time, I start seeing patients develop neuropathy, funny sensations in their feet, numbness in their hands and feet, okay? You might start getting cramps, all right? You start losing your balance, all right? How do you know you are losing your balance? Well, let's just say, do you find that when you are going up and down the stairs that you have to hold on to the rails? Do you find that when you are walking and if you're looking left and right talking to someone, you start to lose your balance and you start drifting off, okay? Do you notice that at night when you get out of bed to go use the bathroom, unless if you turn on the light, you can't have stable balance? Another thing is, have you taken some falls as well recently? Okay, there wasn't anything that tripped you or very significant that could have caused a fall, but you notice you started falling, okay, once or twice a year. That could be something significant in neuropathy. But with diabetes, the other thing that you have to know is when your vision starts getting worse, okay? Because it kills off the blood vessels, right? So your eyes actually don't have as much blood vessels as you think, but that's farther away from the heart. It's further north, right? The furthest part in your head is your eyes. That you start noticing your vision starting to get a little blurry. And what this study found was people with blurry vision increased the chance of falling by almost 50%, okay? So what they did was they tested people who had blurry vision, and you know, some of them were from diabetes and then they had the neuropathy, but they have a 46.7 chance of falling the prior year, which means out of the people who couldn't see very well, almost 50% of them had falls the year prior. All right, this is the same age group that they're testing. The same age group without having blurry vision, their chance of falling was under 20%, okay? So you have to understand that diabetes is not something that should be taken lightly. I don't take it lightly. Our patients should not be taking it lightly. If you're a patient and you know that you have diabetes, you ought to let me know, okay? And we ought to schedule a neuropathy exam for you so that we can start correcting some of the problems before it starts getting worse. See, the worst thing is not knowing, and then all of a sudden it hits you, okay? Why do you think doctors, medical doctors, podiatrists tells patients, their diabetic patients, to check their feet all the time? The reason for that is because that lack of blood flow when you are diabetic cuts off the flow, the blood flow to your feet. Say you're walking around and you got, you scrape your feet, okay? You got injured somehow, some way, and you just have a wound. It's an open wound, right? We stub on things and step on things all the time. But because you do not have the right amount of blood flow, that open wound becomes, instead of healing over the next few days, it becomes an ulcer. All right, it becomes infected. You don't have oxygen to the blood. There's no turnover, so it becomes infected. And from there, it becomes dead skin tissue. Now, if that infection infects the bone, what do you think happens next? That's right, they have to start amputating. You know, diabetics who've got amputated feet, toes, fingers, okay, all the way to the hands and forearm. Sometimes you notice diabetics, they're walking around with only half their knee, all right? Or only half their leg below their kneecap. That's what's happening out there. And I don't think enough people are aware of the severity of what diabetes is doing to your body. Another thing that most people don't realize is there's something called autonomic neuropathy. Because when you have become a diabetic long enough, not only will your hands, your vision, your feet start not to work correctly, your heart starts to not work correctly, your lungs, your liver, your colon, that's a big one. The reason being is because those organs are also not getting the right amount of blood flow. There's too much sugar going to those organs as well. And that is peripheral neuropathy, doubled whammy with autonomic neuropathy. That is a huge, huge deficit in anyone's life. This will create so much impact in your life. You don't even know how much impact it will create. We see patients in here that come in for neuropathy all the time. And why is that? And I think this is one of those things where not enough people are sharing because not enough people know about it. So normally, here's what Western medicine does. Western medicine, normally when you go into the doctor and you tell them you have neuropathy, they say, okay, well, you got to cut this out, cut that out. And then they give you a packet, okay? The packet of foods that, oh, these are the things that you could eat. These are the things that you shouldn't eat. The craziest thing that I've seen, and this is a huge myth out there, for people to think that you can eat wheat bread and whole grain bread, but not the white bread. All right? For those of you who want to know why I am so opposed to it, the best book you can read about why wheat is not good for you is a book called Wheat Belly. All right? It was written by a medical doctor, Wheat Belly. Read about it. Because wheat has been shown to raise blood sugar so quickly, in some studies show even higher than sugar itself. Okay? So you have to understand that the same packet in nutrition that a lot of even dietitians, nutritionists, and medical doctors have given you is something that was used a long time ago and is no longer valid today. If the doctors and your specialist, the diabetic specialist, endocrinologist is actually really up on par with all the different studies, they would actually tell you to do something completely different. All right. I would urge our patients to also look into intermittent fasting. Okay. There's a doctor named Jason Fung. He's an MD. He's a nephrologist. He specializes in taking care of people with diabetes. I would watch some of his videos as well. All right. There's so many people out there that are speaking the truth that are also on the same boat as me, is because they feel like people need to know the truth. Okay. Because once you know what the truth actually is, can you reverse diabetes? I've seen so many stories of people being able to reverse diabetes if it's done correctly. All right. I mean, there's studies out there. You can watch the videos out there on YouTube. Just type in how to reverse diabetes or people's experience who have reversed diabetes. You'll be able to see there are so many studies out there. Have we been able to help our people with neuropathy? Oh my gosh. Absolutely. Absolutely yes. Okay. The statistics are astounding, right? a good part of our office is being able to show, putting together a program to help people with neuropathy. Because neuropathy, it's not something, you can't take it lightly anymore, folks. It is something that is very prevalent. When you have diabetes, the chance of you getting some form of neuropathy is up to 70%, which means 7 out of 10, which means if there's about 20 million people in the US who have diabetes, there's about 14 million, up to 14 million people who have neuropathy, and you don't even know it. And the worst thing is when it gets bad to the point where you know it's bad. You've been told it's bad. No one told you how bad it could get. And you walk into our office, we have people that walk into our doors that says, well, Dr. Tam, I know my neuropathy is really bad. I can't feel the carpet anymore, or the floor feels the same. And we take them through a neuropathy test, the sensory exam that we do, and we realize we can't help them. A son brought in her mom. Mom was in her 60s or 70s, and the son realized mom is getting a lot worse. Mom recently moved in with her son, and he says, you know, the doctor keeps saying she has neuropathy. I don't know what it is. I saw one of your ads on the paper, and I decided to come in and get mom checked. As we were doing the tests, and I kid you not, as we were doing the tests, she could not feel anything in her feet. Anything. It was zeros all the way across, right? We mark it from 0 to 10, and it was zeros all the way through. So for those of you who have diabetes, who've got neuropathy, if it's affecting your balance, your feet, the way you walk, you can't go up and down the stairs as well. You can't take long walks anymore. If you cannot go from sitting on a chair and getting up from a chair without putting your hands on the handles or your feet, that is a huge dysfunction, okay? And that is one of the gauges where you will have increased falls if you cannot do that, all right? So reach out to us, but really watch, take a look. The two books that I've told you about, if you want to know why wheat is bad for you, watch the book or read the book called Wheat Belly. You want to know more from a specialist that talks about diabetes and how to help that, what you can do, all right? Look at videos from Dr. Jason Fung, okay, MD. He's a nephrologist out of the Toronto area in Canada. So watch his videos, okay? So until next time, be safe out there. I want everyone to not only be safe, but be healthy, because all I want to do is make sure your health is on check, you have good function, and your longevity is great as well. Until next time, have a great day.